Electronic Medical Records, Benefits for the Healthcare System by Elizabeth Newman, RN, ADN. Why do we need the electronic medical record, or EMR? In this presentation, I will discuss ways the EMR is able to improve the following: access to patient information, documentation, patient care, healthcare quality and convenience for patients, quality measures, provider decision-making support, and care coordination. Electronic medical records are a large part of the electronic health record in today's medical environment. In order to stay current with healthcare, it is important for our hospital to move to electronic medical records and electronic health records. As this slide shows, the EMR contains all the information included in a traditional paper chart and more. The benefits of an EMR and EHR for our facility are multiple. They range from allowing information to be found and shared at the touch of a button, to enriched quality and value of our nursing documentation, to improved patient health outcomes. Using an electronic format can be similar in flow to a paper document, but also allows for structured drop-down menus that trigger pertinent charting based on diagnosis, symptoms, and interventions. Many EHR systems allow nurses and providers access to evidence-based tools to assist in making decisions about a patient's care and to increase knowledge about a patient's diagnoses and needed assessments. Some advantages of the EMR include improved access to information for all members of the healthcare team and the healthcare system, better and more complete documentation, improved quality of patient care, advanced communications and productivity, the ability to track pertinent information and data in a structured way, which can be used in research and quality initiatives, and enhanced regulatory compliance. EHRs improve patient care in a variety of ways. By having quick access to information, care is more efficient and coordinated. EHRs require that providers input their own orders into the EHR, thus eliminating errors in deciphering of provider handwriting and decreasing delays that often occur when waiting for orders to be clarified. Referral information is easily accessed and shared. By having improved documentation by providers and nurses, coding and billing are more accurate, improving revenue flow in a timelier manner. Patient participation in their own care can be fostered with EHRs. Providers and patients can use an EHR portal to communicate electronically, thus allowing more frequent communication, which can lead to earlier identification of patient symptoms. Patients using electronic healthcare portals can also access their health records, as well as any education and reminders that have been suggested by their providers. This information can include reminders for follow-up visits with providers, self-care instructions for home, and links to web resources. Providers are able to give patients full and accurate information about all their medical evaluations, along with offering follow-up information after an office visit or hospital stay by accessing the patient's EHR. Quality improvement is a major benefit of EHRs. By being able to quickly access data from EHR documentation, hospitals are able to identify problems and make improvements in a timelier manner than with paper charting systems. Applying this data to a variety of quality initiatives allows for development of best practices for patient safety and to have better patient outcomes. EHRs supply information in ways that benefit patients and assist providers. As an example, by using information gathered by a primary care provider and recorded in an EHR, a provider in the emergency department is alerted when accessing an unconscious patient's EHR about the patient's life-threatening allergy, allowing emergency staff to adjust care appropriately. In conclusion, we have covered many benefits and advantages of EMRs and EHRs. These included improvement of our patients' healthcare experiences and their outcomes, advancing quality measures by making our documentation stronger and by supporting our providers' decision-making, And lastly, by positively coordinating patient care in the overall healthcare system. By implementing an EMR and EHR in our hospital, we will be receiving these benefits as well as be compliant with governmental regulations for the advancement of healthcare information technology. I hope that this presentation provided a strong case for the need for our hospital to move forward implementing an EMR and EHR. Thank you.